Cancer cells wreak havoc on the body as foreign tumors grow, uninhibited, because they proliferate uncontrollably. One proposed mechanism to treat cancer and stop uncontrolled cell growth is to induce double-stranded DNA breaks, DSB, which do not have a mechanism of repairing, resulting in cell death from toxic buildup of DNA breaks. In ovarian and breast cancer, often BRCA1/2 genes are mutated. BRCA1/2 genes code for tumor suppressor proteins. BRCA1 protein interacts with several other proteins to mend breaks in DNA. With BRCA1/2 mutations, the cancers are unable to go through DNA repair, such as homologous recombination, HR. BRCA1/2 are important for homologous recombination and protection of stalled DNA replication forms. Homologous recombination is a critical DNA repair mechanism by which one template strand is used to make a copy, and then the cell can replicate DNA when a DNA double-strand break occurs. Double-strand breaks, DSB, are toxic for cells and ultimately result in cell death if they are not repaired or repaired through error-prone pathways of non-homologous end joining. In a normally functioning human cell, other enzymes such as p53 and ATM are also involved in recruiting DNA repair proteins before homologous recombination or other mechanism sets in. For instance, poly-ADP ribose polymerase, PARP, is a critical enzyme when a DNA strand break occurs. When this enzyme is inhibited, it can selectively kill BRCA-deficient cancers. In this video, we'll focus on its mechanism of action. The reason for PARP effectiveness in decreasing BRCA mutant cell survival is a phenomenon called synthetic lethality. When both copies of a gene are repressed, there is an impact. PARP inhibition and BRCA mutations together result in cell death due to toxic buildup of DNA double-stranded breaks, because DNA DSBs cannot be repaired efficiently in BRCA mutant cancers. For this reason, BRCA1/2 mutant cells have almost 1,000-fold PARP inhibitor sensitivity. In BRCA-deficient cancers, homologous recombination is not functional, and the cell is directed towards error-prone repair and cell death. Let's take a deeper look into the PARP inhibitor mechanism of action. PARP enzymes are localized to DNA at the site of a single-stranded break, a sort of molecular policeman, if you will. PARP enzymes send signals to recruit single-stranded break repair and base excision repair machinery. When PARP is inhibited, there is trapping of the poly-ADP ribose moieties on DNA. This is a post-translational modification called PARylation. PARylation involves attachment of poly-ADP ribose, PAR, moieties to histones and proteins, and there is nothing to remove those bodies. As a result, the cell faces genotoxic stress. As PARP1 enzyme activity is inhibited, PARylation, the DNA damage sensing, does not occur properly in the cell, and cells cannot go through the typical damage response scenario. Replication stress is induced due to the trapping of inactive PARP on DNA and lack of base excision repair. In this way, the cell depends solely on BRCA1/2 for DNA repair of the double-stranded breaks. Yet, in a breast or ovarian cancer cell, there is a mutation of BRCA1/2, and the cell does not have the ability to go through the DNA repair process, homologous recombination, as mentioned before. Alternative repair pathways in the cell are not effective, leading to genomic instability and tumor-specific cell death, cytotoxicity. PARP inhibition succeeds at therapy because it focuses on DNA replication mechanism, which allows cancer cells to proliferate. PARP inhibitors actually have promise both as a monotherapy and combination therapy with traditional chemotherapy. PARP inhibitors have been approved for use in ovarian cancer in a capsule format. One of the most important factors for researchers currently is dosing levels, as well as effectivity in other cancers with DNA damage, endometrial, prostate, or pancreatic. A major hurdle for PARP as a treatment is PARP resistance, which is described in the paper Yazinski et al. There is a possibility to combat this by introducing ATR, a protein kinase inhibition. Overall, PARP inhibitors are a great addition to chemotherapy as a cancer treatment for BRCA-dependent cancers. There are many less side effects with this new therapy, as opposed to chemotherapy, which causes patients drastic side effects. PARP inhibitors offer a potent, promising alternative therapy for breast and ovarian cancers, which kill almost 595 people annually, according to the National Cancer Institute. This therapy, due to unique biological mechanism of action, has much less drastic side effects than chemotherapy.